I am going to give a presentation now over the next 40 minutes that it talks a little bit about who Purina is, where we've come from historically, some of the accomplishments of Purina, and some of the advancements and how we're going to move forward. I don't want it to come off as braggadocious. It's not. It's just meant to be more of a presentation of, again, who Purina is. And when you think of us, thinking about how we're a company that is grounded in science, how we have been, how we are, and how we will be, continue to be in the future, so that you can feel comfortable with Purina and incorporating our diets, our supplements, whatever it may be that you're utilizing from us, into a wellness or a therapeutic plan for cats. I will have a little bit about dogs in here, but that is more to demonstrate a point and some of the landmark studies that we have performed over the years. So, what you're going to look at on this slide is a timeline, obviously. It is in chronological order, and it talks about a history of research and technological innovations. I'll have a few of these slides within this presentation. This is the research and technological. I will have a couple more later in the presentation regarding nutritional innovations. You can see that there are a number of accomplishments here of Purina over the years. I'm not going to go into every one of them, but we will start off first with 1894. William Danforth is our founder, and he was seeking to feed the purest nutrition in an easy-to-feed format. What I would like to point out is more so not when we were founded, but more of that's over 130 years that Purina has been making food. There's a lot to learn in that time. There's a few mistakes to be made as well. But it's important that we learn from our mistakes. More importantly, over 130 years, you gain an appreciation for the diversity and subject matter experts that we have on staff. And we have, just simply where I'm located in St. Louis in our North American headquarters, we have over 2,500 people on that campus. We have thousands more globally, and as Natalia mentioned, we at the Purina Institute are privileged to be that communications, that amplification arm to the veterinary health profession of our research department, and also others of evidence-based medicine that is within the veterinary literature. In 1916, we opened up our first analytical laboratory that's known as NPAL, Nestlé Purina Analytical Laboratories. The reason I'm bringing this up is because we have that NPAL is part of the quality assurance department that we have that is a global department, and we have over 50 of our own factories globally, and we are able to instill that food safety and quality assurance program as well. And then in 1926, we opened up our research and development center for dogs at that time. At the same time, a major accomplishment, that was the first complete and balanced food that existed for dogs. In the 1950s, we began studying cat nutrition and cats' idiosyncrasies, whether that be thiamine, the arginine amino acid idiosyncrasy, the total protein concentration idiosyncrasy that they may have. Cats are wonderful and beautiful creatures that need their own research, and we've made some serious accomplishments and collaborations with other people over time there. We opened up a cat care center in 1965, and we do have cat and dog pet care centers throughout the world. One of them is actually in St. Joseph, Missouri, which is across the state from St. Louis, and the other is in Amiens, France, that represents Europe. These cats live the most wonderful lives you'll ever find. Dr. Sandra Lin can probably talk better to that than I can, but they have an amazing amount of environmental enrichment. We even adopt out these cats and dogs to our employees and to the public. We even have a program for that as well. They are also the pets that we do all of our feeding trials with, our digestibility trials. We do our fecal scoring. We do urine pH as well. Because when we produce a food, we want to make sure it goes out there and we know how that food performs as well with all the cats in the population. We opened up an R&D facility in 1989 in France, and we followed that in 1990 with an R&D facility in the United States. If you do get the chance, some of you in the audience, it was very nice to reconnect with you while I'm here. If some of you have been to our campus, if you get the chance and you happen to be in the States, please feel free to contact me. I'd be happy to connect with you and provide a tour of St. Louis for you. It's a wonderful campus. That R&D facility that's there does much of the protein, lipid, carbohydrate metabolism. They do some of the microbiome work as well, and so forth. In 1957, Purina created the concept of what we term a kibble. We created the process of extrusion, and we continue to maintain patents on that machinery and the process of the extrusion as well. We followed that up in 1962 with the first extruded dry cat food as well. The importance of this, I need to underscore this, just because pet food wasn't what it is today without Purina doing this. If you are not familiar with an extruder, I'm not sure why you would be, but what I will point out, and I'm going to greatly simplify this, if you think about a cylindrical box where ingredients go in one side, and within that cylindrical box is a screw or two screws, and they are moving at a certain rate, at a certain pace. There's a temperature, there's a pressure, there's friction that goes and cooks the ingredients and pushes those ingredients into the other side where there's a die on the end that creates a shape of a kibble and a blade cutting, and out comes the kibble at that point. The reason that this is important is because you can see that was 60 to 70 years ago, and over that time we've learned what is the optimal amount of pressure, what is the correct temperature to be cooking the poultry, the beef, the fish. They're all different, and we have optimized that over time, which then, when we do that, we feed to our pets in the pet care center, and that is what creates the high digestibility products that we offer with a low residue of fecal score. I do want to point out as well that we are the creators, in 1993 this is, of the body condition scoring system that is the 1 through 9 scale that is widely used throughout the world. Even the World Small Animal Veterinary Association uses a 1 through 9 scale. We have been very big into weight management and weight loss over the years. At this point, over 60% of cats and dogs are now considered overweight or obese. So we encourage veterinarians to be utilizing a tool like this within their everyday appointments. You can get this tool on PurinaInstitute.com within Center Square if you like. We created the first weight loss and weight maintenance diet in 1976. It seems common sense to say, yeah, lower the fat, which will decrease the calories, and increase the fiber, which will increase satiety of appetite. That wasn't known until then, and Purina had done that in 76. Along with that, as we move into the 90s regarding weight loss, what you find is Purina is a company that believes in a higher protein concentration as part of their nutritional philosophy. And the reason for that higher protein is to preserve lean body mass as you lose weight. So if you look at the bar graph, what you'll see there is a total amount of weight loss in two groups. One group of cats eating 35% protein diet, the other group eating a 45% protein diet. And the total loss, weight loss that occurs in each group, the gray bar is the amount of fat loss. The blue or teal bar is the amount of lean body mass loss. And as you can see, as you shift to a higher protein at that 45% group, you'll find that they lose more fat and a lower amount of lean body mass. It'd be nice if you could tell yourself that you could just lose fat during a weight loss program, but that's not realistic. So you got to lose some lean body mass. But the reason you want to keep the lean body mass is because protein in and of itself does stimulate metabolism. That's why we're putting a higher concentration in the diet. It does contribute a small amount to satiety of appetite. And the lean body mass itself that the protein is contributing to is metabolically active. It is inherently burning calories for you. So you don't want to be losing the ability to burn calories during a weight loss program. So again, the higher protein is significant there. And as we move into the current day, you'll find that we do have those higher protein diets when you start to compare weight loss diets across the board. While all of this is going on, and we're making advancements in weight loss and weight management, we were also performing what is known as the lifespan study, which is a 14-year study that went from 1987 to 2001. Out of this data set of 48 Labrador retrievers came 12 publications that are very significant, and anybody that performs any sort of weight management or weight loss study at this time still continues to cite this study. It was so significant. May I see a raise of hands in the audience if you know this study? I have a few hands, thank you, appreciate that. For those of you who are not aware, this was a study of, well, literally what it says, a lifespan study. 48 Labrador Retriever puppies, starting at 8 weeks of age, through life to the age of 14 when they passed away. And what you have is the 48 puppies being split into two groups, one group being the control group, who is fed twice a day for 15 minutes at a time, eat what you want to eat, ad lib. The other group is the lean-fed group, who eats 25% less calories than their paired littermate in the control group. And we follow them daily throughout life. The gist of that lifespan study basically is, how long do you live? And it was on a median lifespan was extended by 1.8 years longer. This is all simply due to calories, because all of the dogs were exposed to the same environmental variables. All of them are eating the same diet. And again, the significance here is that the dogs that were lean-fed wound up being between a BCS, or body condition score, of 4 to 5 versus the control group at 6 to 7. And you can see an example in that picture of what a 4 to 5 looks like on the left there. We actually went back and we changed our body condition scoring system. We also changed our feeding requirements as well at that point, which seems odd for a pet food company to say feed less, but it's the right thing to do to allow for that longer lifespan and also to keep pets in home living better and longer lives. Not to be outdone, the cat. We did do a study that was a 9-year study in cats. We started them, this is a lifelong study where we started them off at 7 years of age, and we followed them through for 9 years until they passed away at the age of 16. And what we found in this study with a certain nutrient blend that we created is that we can increase their longevity, and we were able to improve certain health parameters that you can see there on the screen of weight maintenance. We all know that cats, they become more skinny old cats. We were able to maintain that weight with our blend. We increased their antioxidant status as measured by vitamin E in the serum, and they were less frail because they had a greater bone density and skin fold thickness as well. What this study entailed was 3 groups of cats. One group eating a control diet that lived to the age of roughly, on average, 14.7 years. The second group eating the same control diet that then also had antioxidants, vitamin E, increased. They lived a little bit longer, 15.1 years on average. And then the third group was actually the group that contains that blend I mentioned on the last slide, where they were eating the same control diet, they had the increased vitamin E, and they also had increased essential fatty acids of omega-6s and omega-3s, as well as the prebiotic chicory root. That blend has been applied throughout our portfolio of diets as well. So if you're interested in a longer lifespan of cats as well, we do have this blend within our diets. And keep in mind chicory root, because I'll bring that up in a few minutes here. This is a timeline of nutritional milestones and leadership of where Purina comes from. I'll just move right into this and mention taurine. We were putting taurine into foods since 1961. We were supplementing our foods with that in the cat food. It is an essential amino acid of cats and plays a role in heart activity, as we know, because in the 1980s there was a problem with some pet foods that had dilated cardiomyopathy in cats. Purina did not really have this issue because we had been doing it since 1961. I'm going to move right into urinary health. We heard a bit about this from Dr. Westrop yesterday, some wonderful presentations. And my reasoning for bringing this up is because Purina took the time, the effort, and the resources to connect with a governmental agency like the Food and Drug Administration, or FDA in the United States, to advance urinary health in all cats and advance the pet food industry in that regard. We created the first urinary tract health product. We followed this up as well with fiber, creating the first hairball diet in 2001. We don't often think about that as a breakthrough, but it truly is. Hairballs can be managed through pet food and through the use of insoluble fiber. So as the cat grooms, the hair goes in the digestive tract, and the insoluble fiber will bind it and pass through the digestive tract. Something that we're also very proud of is in 2001, we came out with a therapeutic diet. We revolutionized diabetes in cats. So up until this point, it had been thought, hey, you know what? Humans, dogs do well with increased fiber to smooth out glycemic indices. You know what? It must work for the cat. And to a degree, it does. But this is the beauty of having the subject matter experts that we have at Purina to come together from a vet nutrition standpoint, the microbiology, the toxicology, and all of the experts, the behavior experts as well, to say, hey, you know what? We can do better. We created that diet that is a higher protein diet, a very low carb diet. Yes, it does have fiber to smooth out glycemic indices, but the reason we're doing the higher protein and the low carb is to work with the metabolic machinery of a true carnivore. And we, to this day, remain the only company that's been able to show remission of diabetes in cats through diet alone. We also do have colostrum in our diets. I believe Dr. Lappin mentioned this yesterday in his presentation. Colostrum is able to stimulate the immune system. We often think about it as mother's milk for the kitten, and it is, but as an adult, colostrum can also stimulate the immune system starting in your gut. 70% of your immune system is in the gut, so we can stimulate that by having those antibodies that are in the colostrum connect with the immune system, those lymphocytes in the enteric system, that then can help to create IgA, or immunoglobulin A, locally, and also connect with the local immune system or the local lymph node to have the release of cytokines that will then stimulate the production of IgG. So it's a priming of the local and systemic immune system at that point, and the bar graph on the right is demonstrating that in the colostrum group, in that bluish-greenish color, that we are able to increase their fecal IgA. Some further nutritional innovations in pet health. I would be remiss if I didn't mention that Purina was acquired in 2001 by Nestlé, one big corporation coming together with another big corporation. It's actually been kind of a beautiful marriage, if you will. That's what's opened the door to me having the ability to say to you, we have over 500 scientists. And it's really, truly a way that Purina innovates through pet food, supplements, et cetera, because that's translational medicine. There's crosstalk on a daily basis from us in vet med to them in human nutrition, and it is a competitive advantage for us because no other pet food company can really say they ladder up to human nutrition. And what you're looking at there is a gastroenterology center that was founded in 1987 that has been researching the microbiome through the use of probiotics and prebiotics. We at Purina have been using prebiotics in our pet foods since 1998. Prebiotics have a more grand effect on that taxonomy of the microbiome. In particular, we do use quite a bit of chicory root, inulin, alurone within our diets because what happens is prebiotics have many effects on a cat's physiology. They have the ability to selectively enhance certain what are considered beneficial bacteria or microbiota, specifically the generation of bifidobacterium and lactobacillus and enterococcus that are lactic acid fermenting bacteria. So prebiotics can increase the beneficial bacteria in your microbiome, which then in turn increases short-chain fatty acid production and that is the preferred fuel of the colonocytes, helping epithelial turnover during episodes of colitis. They also can decrease the intraluminal pH of the colon as well, and what that does is create an inhospitable environment for pathogens to proliferate. Chicory root happens to do a better job at this than other prebiotics, and that's why we've been using it. One of the most significant breakthroughs in nutrition is the use of the probiotic Enterococcus lactis SF68. Dr. Lappin talked about this quite a bit yesterday in many of the studies that we have collaborated with him on, and has shown benefits not only in gastrointestinal, but specifically in the immune system of cats as well. So very significant probiotic that is a perfect example of the benefit of laddering up to Nestlé. Nestlé had isolated this strain of bacteria from a human infant in 1968, and that's why it's called SF68. And it is the most widely researched probiotic out there. It has over 25 publications to it. And again, it has benefits in both cats and dogs. But again, thank you, Dr. Lappin, for doing many of these studies and showing the great benefits that it offers. We have followed up on probiotics, and we did launch a probiotic in dogs in 2019, known as Bifidobacterium longum strain BL999. Dr. Lappin talked about this yesterday as well. In dogs, it has been shown to promote a decrease in anxious behaviors, such as barking, jumping, spinning, and pacing. We followed it up a few years later with Dr. Lappin. He talked about this yesterday, begging us to do this study. I remember discussing this study in a lobby of certain lobby of Western Veterinary Conference with him, and this study resulted in a decrease in clinical stress response for cats. They had less pacing. They even had decreased sneezing, which may be associated with certain upper respiratory infections. They had an increase in social interactions with the people that were attending to them. They felt more comfortable with them, and they had a decrease in biochemical stress. So it's always measured through serum cortisol, which is your stress hormone. It's very nice to do a study like this where you compare those behavioral aspects with those physiologic aspects and really strengthen the validity of the study. So this is a product that is also available in Purina supplements. We know we don't know everything. We have a great number of subject matter experts at Purina, but we need to collaborate with others. We are industry leaders in microbiome. We're very proud of that. But we wanted to partner with others that are researching from the academic point of view. So we connected with the folks in the gastroenterology laboratory of Texas A&M University. They have over 25 years of experience themselves in gastrointestinal function, the testing, the pathogens, and even the microbiome ecology. So this is a very nice partnership that we have moving forward for the betterment of improving the microbiome, first of all, understanding the microbiome, but then improving it to promote optimal health and wellness in cats. I do want to shift a little bit at this point to another area that Purina has researched, which is cognitive function or brain health. So we created that first diet that supports epilepsy and also supports cognitive function in dogs. And as a dog gets older, around the age of 6, 7 years old, they start to have cognitive decline. They're not utilizing the glucose as well as they used to. This is kind of the equivalent, when I say cognitive decline, of you and me forgetting where we left our keys, and then we find them, and everything's fine. Then they may progress to something known as cognitive dysfunction syndrome, which is more like the Alzheimer's dementia patient. And never mind, I forgot where I left my keys. I don't even know where I live. So we sought to see if we can help with this in dogs, and then we followed it up with cats. And what we showed first in dogs was through the use of medium-chain triglycerides, or MCTs for short, which is a different type of fat source. Typically, you and I and cats and dogs eat long-chain triglycerides in our diet. These are medium chains. I won't bore you with the biochemistry of that, only I am interested in that. But they do take on different properties, and through that, these MCTs can get converted in the liver to ketones, freely cross the blood-brain barrier, and then act as an alternative energy source, since cats and dogs are not utilizing the glucose as well as they used to. When they do that, we have been able to show significant benefits in that cognitive realm. So along with medium-chain triglycerides comes a blend of antioxidants, arginine, B vitamins, and fish oil. And we did do a study in dogs with the folks at CanCog in Toronto, Gary Landsberg as a veterinary behaviorist. It was a 90-day study, and we were able to show that we could improve within those 90 days all 6 signs of DISHA, which is how we all measure in veterinary medicine the degree of cognitive health in dogs. So DISHA being disorientation, social interaction, house soiling, etc. And we were able to improve all 6 signs, again, in 90 days. We followed that up with cats as well. We have a blend for them, which is very similar, but they are without the medium-chain triglycerides. So fish oil, B vitamins, antioxidants, and arginine as well. And we were able to show that we displayed, they displayed better memory and problem-solving ability as well. I do want to shift a little bit now into something we don't often think about, and I am glad that Sandra Lin is here as a behavior expert with us and gave such a great presentation yesterday. Thank you, Sandra. Nutrition and behavior is something that we have been researching for, really, if you think about it, decades. It's been going on for some time. It's progressed into feeding behavior as well, and the understanding of what a cat prefers. I'm not going to belabor that, as Sandra did a much more eloquent job than I can ever do on that. And so through some wonderful studies, but I hope you gain an appreciation for that discipline that then applies to veterinary medicine and the understanding of how to improve a cat's experience in eating. I will move into feline elimination, and a lady named Dr. Reagan McGowan, who is one of our other experts, she's an ethologist by trade, and she became interested in feline elimination and the understanding of the litter box. What she did over the course of 10 years was to track their elimination behavior and collected this data to apply to artificial intelligence, or AI, models. And through that, we're able to create more of the algorithm and in this understanding, and to help improve that environment. And you say, well, how so, and why are we doing this? I will preface this with saying, throughout the world, probably half the cats that exist are not coming into the vet, because it's a very stressful experience for that owner to get the cat, put them in the crate, the cat gets stressed out, the owner gets stressed out, and then the vet gets stressed out, frankly, when they come into the office. The cat is not happy. So we need to be meeting these cat owners where they are in home. There are a significant amount of hurdles to understanding their elimination events, though, in-house, because the litter box is kind of secluded. It's in another area. It may even be covered. It's common for cats to be even secretive at times as well. We don't often see them when they're eliminating. And it's also difficult for owners to monitor multiple cats within the household as well. Who's doing what? And you're saying, how do you go about doing this? So if you create a device that Dr. Quimby mentioned in her lecture just now, and you place this under a litter box, you can actually gather this data and you can see on this chart here, this graph, where a cat will enter a box, their behaviors of how they sniff, they start digging, and then they perform their elimination, they cover it up, and then they exit the box. You're saying, why on earth do you care about this? This is so either fascinating or could be gross to some people, but it is wonderful, because if you think about it, at minimum, this device could be a scale where you can track weight trends over time. Cats may be unintentionally losing weight but maintaining their appetite, right? So you start to think about, if a cat has an increased appetite, or they're maintaining appetite, but they're losing weight, is that hyperthyroidism? Is that diabetes? If they start, losing weight and they have a decreased appetite, maybe they're advancing into chronic kidney disease, and so forth. Again, this is not meant to be a diagnostic tool whatsoever, but it is meant to be more of an assessment or measuring tool that, because cats are not coming into the veterinary office as often as they used to, we can start meeting those cat owners and those cats in home and say, hey, we may have a problem here, bring that cat into the vet office. So that is where we're kind of advancing toward devices. So diets, supplements, devices. We've also been within litter as well. We have a litter company. Litter was invented in 1947 in an effort to bring cats indoors, increasing that human-animal bond between dogs and cats, cats and humans. We have a number of advancements that we've made through 2008 and then even into this upcoming year of 2026, whether it be a pelleted litter system where you can collect urine, lightweight litter, unscented litter, low tracking litter, and then even performance litter where we may be able to use litter as more of a measurement tool to assess health in addition to devices. We understand this, just like the microbiome with Texas A&M, we understand we don't know everything. So what we've done is we formed a partnership with UC Davis's Urinary Stone Analysis Laboratory. Thank you, Dr. Jody Westrup. Again, wonderful presentations yesterday. And the understanding of that, we maybe desire to be that number one in urinary from an industry standpoint, but we need the help of the academicians and their knowledge to advance urinary health for cats. I'm going to wrap up here in a couple minutes here. This is one of my last slides. I'll bring this one back, but now we have the rightmost column here with human-animal bond and well-being. Again, this is something that we've been looking at for many, many years. It's just it's a topic that, though, comes to the forefront more so now than it has in the past, which is a great thing. I wish it would have come a little bit earlier. But what we've been looking at is how do we keep cats living longer, better lives, of course, and increasing that human-animal bond with them and improving the health and well-being, not just of the cat, but also the human as well, and that companionship. One of the most significant breakthroughs that we've had and was launched in 2020 globally was the concept of helping to manage cat allergens in humans. So, when you have an allergy to cats, you often think of the runny nose, the runny eyes. We have an immunologist, again, another subject matter expert. We have immunologists that we have on staff, and he had a daughter who had an allergy to cats and sat back and thought, well, how can we help manage this because my daughter really wants a cat? So 13 years in the making, we wound up creating an antibody to the most common cat allergen, which is a protein known as FeLD1. FeLD1 is a protein that is secreted in the saliva of cats, and again, the most common cat allergen. If you have an allergy to cats, it's probably 95% of the time it's due to FeLD1. This protein has no known physiologic function, and we're not going about changing the immune system of cats either. There's no change in physiology whatsoever. But what he did was thought, can I create an antibody to FeLD1, and then we could put that in the egg powder that gets sprayed on the coating of a kibble after manufacturing, so that when the cat consumes the kibble, that antibody can then bind the FeLD1 that's in the saliva of the cat. And it turns out this does work. There were a series of studies, as I mentioned, it's just 13 years in the making to come to life. And through a series of studies, we've been able to show an average reduction of FeLD1 by 47% in week 3. You can see the range there, weeks 3 to 10. The range of inactivity of FeLD1 is 33 to 71%. Cats vary, humans vary, et cetera. But this is a major advancement in keeping cats in home. It's also a major advancement in really shelter medicine as well, decreasing relinquishments, and the ability for people to adopt cats. Those that love cats want to bring them in home that have allergies, they too now can have cats. So this is, again, a wonderful advancement. I have not had the opportunity to go over every advancement with you that Purina has made, but I hope you gain an appreciation for where we have pioneered some of these advancements from a nutritional, a technological, a litter, a behavior, and even human-animal bond advancements. And we start to ask even ourselves internally the question of what is next. So be on the lookout for those advancements within our diet supplements technology, and I wanted to take the opportunity to say thank you to all of you, and I greatly appreciate this time with you.